Hi, everyone. I'm really excited to be here today, to already have heard the speakers and panels that we've heard, and to be a part of this panel. I'm Melissa Stafford Jones. I work for the California Health and Human Services Agency. I'm the director of the Children and Youth Behavioral Health Initiative, and I'm just really pleased to be here today with my colleagues Autumn Boylan and Dr. Sean Powell. So we are each going to be presenting for about 15 minutes, and then we'll take some questions at the end. I want to just start before I get into my presentation with just connecting to everything that we've heard this morning. I've been in this role for about 2 years, and I want to just start with a gigantic thank you to the people in this room, but also beyond. People have been incredibly generous with building relationships to work on the Children and Youth Behavioral Health Initiative. And lots of new relationships. Not where people already knew each other, but where really people had not worked together, did not know each other, but said, this is an opportunity to do something for our children and their well-being and their thriving, and giving of their time, their energy, their partnership, their collaboration, their expertise, both people with professional and lived experience. Taking that risk and saying, we'd like to be a part of the work of the Children and Youth Behavioral Health Initiative. And so I have a lot of gratitude for all of that work that all of you have done in partnership with us. So thank you. So my job today is to give you a bit of an overview of the Children and Youth Behavioral Health Initiative, and then you'll hear from my two colleagues from both a health and education perspective and how we fit all of these pieces together. And as Dr. Powell said, as we were getting ready for this just a minute ago, there's a very clear through line from what we've already heard this morning, so we will do our best to draw those lines for everyone. So this first slide, I don't need to tell you what's on this slide. You know that our children and youth are struggling with their mental health and well-being. But I include this slide because I just want to take a moment to ground ourselves in that data and in that reality, and to remind ourselves that all kids and youth can, and many have been struggling with mental health challenges for more than a decade, is what the data tells us, exacerbated by the pandemic, but those trends of increasing mental health challenges for children and youth were already happening. And though all children can face mental health challenges, we do know that certain groups of our children and youth are disproportionately impacted by those challenges and face greater systemic barriers to accessing services and the supports they need for both treatment and well-being. And that is our BIPOC youth, that is our LGBTQ+ youth, that is our youth and families from low income and underserved communities. And so that is our starting point, that is what grounds our work together. But the good news is we also know that, as we heard from Nikki earlier, from Dr. Parr, that prevention and early intervention can make a difference in the lives, the learning, the thriving, the trajectories of our kids. The work of the Children and Youth Behavioral Health Initiative is grounded in Governor Newsom's master plan for kids' mental health. And what's important to know about the master plan for kids' mental health is its intention to take an all of the above cross-sector, cross-systems approach. It's multi-initiative, it's multi-agency, it's multi-year, it's multi-billions of dollars. And it calls us to take an approach of one, and to really think about how all of those pieces and initiatives that we have can come together to support the mental health and well-being of kids in California. The Children and Youth Behavioral Health Initiative is at the core of the governor's master plan for kids' mental health. And as you've heard, the CYBHI is a 5-year, more than $4.5 billion initiative to really reimagine, but also build an ecosystem of services and supports to improve access and outcomes in terms of behavioral health and well-being for children and youth ages 0 to 25 in California. As we are doing this work of the CYBHI, though, some of our the intent of it, the features of it, the goals are actually really rooted in what you have already heard this morning. One is that we build a more coordinated, integrated system. We have heard from our partners, both youth and families, but also providers and our partners with professional experience, Silos exist and they get in the way of kids getting what they need. And so our work is to figure out how do we come together and build a more integrated system. Secondly, building a more youth-centered system. I think we've heard so much frustration and challenge, not only from youth and families, but from participants in the system about knowing that we are often making decisions or doing things a certain way, not because it's actually what youth need or what youth want. As you heard earlier this morning from Lisa Smoos about the Youth at the Center report that they wrote on behalf of the Children and Youth Behavioral Health Initiative, we need to ground ourselves in what youth want, but also what they need, and what they are telling us supports their well-being and their mental health, and build our systems around that. Thirdly is really thinking about building a more equity-centered system, and that means being intentional, recognizing with the inequities that we have, we will need targeted strategies to make sure that our youth that face the greatest barriers, that we are having strategies that specifically address those issues. And the Children and Youth Behavioral Health Initiative works across the entire continuum. So in health language, we often talk about it as the continuum of care. In our education, often write the tiers, the MTSS and tiers 1, 2, and 3. And so we're working across all of those tiers, thinking about how do we build positive mental health, prevention, well-being, early intervention, all the way to, for our children and youth with the most complex needs, how do we increase their access to services? But across that entire continuum, something we heard in this process of, well, what should we do to reimagine the system, that we heard consistently was the need to focus across that whole continuum on prevention and early intervention and on well-being. In one focus group with youth, they said it most clearly, which is, please stop waiting until I'm in crisis to provide me with services. So this is our work. How do we build a more integrated, youth-centered, equitable prevention and well-being oriented ecosystem? And I will share with you, it's not a secret, but I'll say it's a secret. My secret belief around all of this work is actually what we already saw this morning, which is all of us, I know, are committed to doing this work of change, but it's incredibly hard. Our systems don't make it easy to create what we are talking about and to do this kind of collaboration and collective impact work. I think the secret, though, is if we really listen to our youth and families. If we really keep tacking back to what they are telling us, it will let us find a way through those hard challenges that come up. And I think we just heard that on the panel about the work in Ravenswood. Also, as part of CYBHI, part of that work to achieve that system is deeply rooted in collaboration, in partnership, and on meeting kids where they are. And we know that other than at home and with family, the place where our children and youth spend the most time is in school, is in learning settings. And so that is core to the work of the Children and Youth Behavioral Health Initiative. We know there's a broader system, and that is part of our work, but one of the core elements is really thinking about how do we build that integration and coordination between health and education so that we can meet kids where they are. So how are we doing this work of the Children and Youth Behavioral Health Initiative? We call them work streams. There are 20 of them. I think of them as tools we have in the toolbox of CYBHI. So these are our tools to try to build that reimagined system and to support the vision that we are all talking about together today. I won't go through all 20 of them, but they fall into 4 main categories, and I want to mention those categories. The first is, and we heard this morning already, is building the workforce that we need. And we need a larger, more diverse and representative workforce, and a workforce more capable of addressing the behavioral health needs of our children and youth. And youth have been very clear in all of our engagement with youth that they want a workforce that looks like them, speaks their language, comes from their community, and understands their experience. Actually, I think Autumn and I were on a call together more than a year ago where a wonderful youth advisory group, we had a really nice conversation going, but they were telling us about some school wellness centers they had. And one of the youth essentially said to me, you know, Melissa, you are not the person we want to see when we walk in the door of our school wellness center. Middle-aged white woman, we have plenty of those available to us. You're not who we want to see. We want to see somebody who looks like us. who comes from our community, who understands our experience. That's what we want. And that the first thing we may not want is not necessary clinical therapy. We might get there, they said, but that's not necessarily where we want to start. Peer-to-peer or near-peer is often sort of the place they want to start in terms of services, is what youth have shared with us. But building that workforce that we need. So that there's a lot of investments there during the Q&A. If people have questions about that, I'm happy to talk about that. But we're really working to build a larger, more diverse, greater capacity workforce to support well-being of children and youth. Secondly, is really building up the infrastructure of the ecosystem. And this was touched upon earlier, actually, in a couple of the presentations. And you've already seen this from the presentation, both from Nikki and the panel we had. We don't lack in California knowledge and experience with what we need to do to create the system that we want. We actually know what it is. We even know some of how to do it. What's really challenging, though, sometimes people refer to them as, bright spots or, success stories. What we've heard consistently from our partners, though, is that they are very challenged to make systemic, to scale them, and to sustain them. And so I think of this work in this infrastructure investments in a way as helping to build at the state level those component parts that will help all of these incredible bright spots and efforts that are underway be more systemic, be more scalable, be more sustainable. And you'll hear about some of the key pieces of that, including the fee schedule from my colleague Autumn Boylan in a couple of minutes. But that is really a key piece to funding sustainability of a lot of the work that's happening in the CYBHI and beyond, and that we're talking about today. Thirdly is around coverage, and this is a piece here both about what are the services that are available under coverage, but also how do we make sure that there is payment for services. In this case, we're focused on increasing access to school-linked behavioral health services that are paid for by health insurance, both Medi-Cal and commercial insurance. So another area of growing partnership with health plans to be a part of this ecosystem. And then the fourth area and body of work in CYBHI is around public awareness and reducing stigma. And I want to really appreciate the comment that was made earlier from Jessie around stigma. That what she said earlier about what they discovered in their work is that it was often not stigma amongst youth that was the biggest challenge, but it was stigma in families and communities. That is exactly what we heard from youth in a very long series of engagement sessions, focus groups, working sessions that we have done with youth and families as part of the CYBHI. So not that there isn't stigma amongst youth themselves that we need to address, because of course there is, but they really identified that the larger issue is stigma among their families and their communities, which they understood. It wasn't just stigma to have stigma. It often came from experience of oppression. And so really, how is it that we have culturally relevant and tailored ways of supporting this conversation around mental health? And so there's a lot of work around public awareness that we are also doing as part of the CYBHI. So I want to just spend a couple of minutes talking about integration and how we're approaching some of that work in the CYBHI. The good news is that we, as we've really deepened our efforts to work in collaboration and build partnerships between health and education, what we have seen is that we have a shared set of values and vision around whole child approaches, equity-centered approaches, and really wanting our kids to be well, to learn, and to thrive. And so how is it that we can utilize the Children and Youth Behavioral Health Initiative, working in partnership with education, to have our efforts be more integrated and coordinated? I have two slides here. These are really more for reference. I wanted you to just be able to see, sometimes we take that box slide, that same slide, and orient it this way so you can see some of the key work streams that are most relevant for early childhood, but also for K through 12. So how is it that we've been working to deepen cross-sector collaboration? One of the things that happened a couple of months into the CYBHI is that a lot of partners said to us, we get the vision, we're excited about it, we want to be part of it, but what does it really look like in practice? Like, what's actually going to be any different? And I was very fortunate to have been introduced to Elizabeth. And so we were able to commission Breaking Barriers to write what we called the Ecosystem Working Paper, which really took the vision of the Children and Youth Behavioral Health Initiative. And after interviewing hundreds of folks, having a really incredible cross-sector writing group working together on the paper, this paper highlights the 10 conditions that have to be in place in order to support the vision and goals that we have for a reimagined ecosystem of behavioral health for children and youth. And then, of course, once we produced that paper, and we've been doing a lot of conversations at conferences like this over the last year, people said, but what's next? So now we have this paper, it tells us what the conditions are, what are we gonna do with that information? And so what we're doing with it is we're launching a new demonstration project called Transforming Together, T-Squared for short. And this demonstration project is really meant to help us think about how can we implement in coordination the multiple initiatives that are currently underway to support youth well-being. And we're anchoring the project in 2 of those initiatives, CYBHI and community schools. So it's a 3-year demonstration project to say, hey, what does it really look like? Rather than to think about implementing community schools and CYBHI separately, what does it look like to implement them together in tandem? And so the project includes a couple of different components. We're going to do that in a very small number of local sites and learn. What does it take to do that kind of coordinated implementation and to build the kind of systems that we've been already hearing about this morning in terms of that integration and collaboration across these large multiple initiatives? We're going to be developing a universal roadmap that will be publicly accessible based on what sort of a collective impact integrated systems framework, and then enhanced by what we're learning from those local demonstration sites. And a third component of the demonstration project is all 3 components are directly rooted from the ecosystem working paper, but this one in particular, which said, one of the challenges to creating a more integrated system is that almost all of the TA that gets provided through different initiatives is also siloed. And then it's left to people on the ground to figure out, well, I just met with 9 different TA providers over the last 2 months. How do I put together everything they said? So I'll be honest, we don't know how to fix that yet, but what we're gonna start with, we don't know how, we're gonna start with a community of practice. We are going to invite the various TA providers working on the different major state initiatives that relate to youth behavioral health and well-being to come together and form a supported community of practice to at least begin learning each other's language, learning each other's approaches, and maybe we can begin to break down some of those silos across TA. And then the last thing, these are for your reference because I think the slides will go to everybody. We just wanted to let you know how you can learn more about the CYBHI. We have a website. We do quarterly public webinars. The next one is December the 7th. We do a monthly written update. So if you want to sign up for our mailing list, you can do that on our website. Thanks so much. And I look forward to turning it over to Autumn.
Okay, good morning, everybody. Melissa did a wonderful job giving you the overview of the Children Youth Behavioral Health Initiative, and it's my job to talk about every single one of the 20 work streams. This is a 3-day conference, right? Yeah, just kidding. We had to make some tough choices in what we're going to talk about today, and I'm going to focus on some of the work that we're doing in partnership with schools. I work for the California Department of Healthcare Services, and my team is called the Office of Strategic Partnerships, which I think really is resonating today, and why we called it the Office of Strategic Partnerships, because it's really about working with partners to provide healthcare services strategically and really reaching across outside of our silos, outside of our systems, outside of our comfort zones to engage partners and communities and youth in doing this work. Before I jump into some of the school-based work, I do want to give just a couple of highlights on some of the other work streams that we're responsible for under the CYBHI. In January, we are launching 2 youth-facing platforms that will be providing app-based care, one-on-one coaching support, resources, educational, multimedia, and peer communities for young people. One of those apps called Saluna will be available for 13 to 25-year-olds. And the other, called Bright Life Kids, will be available for parents and caregivers, as well as young children ages 0 to 12. Each of these platforms will focus on providing critical resources and information that kids and youth and young adults told us is most top of mind for them on their journey to mental wellness. So for example, the apps will deal with issues related to relationships with parents, peer relationships, school stressors, work-life stressors, raising your kids, sleep issues, lots of different topics that really run the gamut of those topics that are really the things that young people want to work on their wellness journeys. And these are some of the things I'm going to talk about now are really those examples of ways that we've worked with youth and communities to design this work, because in launching these youth platforms, we talked with over 300 youth in the state of California, and we didn't have a if we build it, they will come approach, but really focused on engaging with young people to design not only the content and what it looks like and how it works, but engage in the ongoing development of how we roll out this platform, how we engage youth to spread the word and to drive adoption. And we'll continue to engage youth as we launch the platform over the next couple of years. The other thing I wanted to highlight is that we are, through a series of grant initiatives, investing in evidence-based and community-defined evidence practices. Most recently, or actually next week, I believe, we'll be making an announcement about a round of funding that is supporting peer-to-peer programs for young people in communities. And really focused on those programs that are youth-driven, youth-led, and really resonated in hearing from our young people today how critically important it is to focus on youth-driven supports and near peers, as Melissa said. So those announcements will be coming out shortly, and we're investing across the continuum of care to make sure that we are building up communities to do this really important work, like we heard from our panel earlier as well. We are also investing deeply in schools to make sure that our health plan partners, as Melissa said, our county behavioral health departments, our local education agencies, and community-based organizations are working in collaboration to provide necessary supports and services to youth. When we did our focus groups with youth, Melissa's already talked about some of the things that we've heard. But some of the other things that we heard as we sat with youth and asked them the question of, where do you know where to turn if you need help with your mental health and well-being? When we were in those rooms and in these focus groups, almost all of the kids sat with their hands lowered. Kids do not know, parents and caregivers do not know where to turn in critical moments when they need help. And by investing in schools, and continuing to support the work that schools are already doing today to provide services and supports to students, we are making services available more widely and broadly where kids spend most of their time and where they know that they can turn for help. Because in schools and with school partners, they have trusted adults that they can turn to provide support. And these are critical resources for our young people in their journey to wellness and in connecting them to community-based resources and supports. One of the key features of the investments that we're making with the Children and Youth Behavioral Health Initiative is what we're calling the CYBHI fee schedule. It provides a reimbursement infrastructure for local education agencies and county offices of education, as well as their community-based partners, to get reimbursed for school-linked and school-based behavioral health services provided to students in a school setting. That includes on-campus services, off-campus services, and mobile clinic services, for example. We really are wanting to think through a more sustainable reimbursement infrastructure where we hold health plans responsible for coverage of services that they're obligated under federal law to provide. And so really thinking about how we make sure that health plans are partnering with our local education agencies and schools to deliver care and upholding their obligations for reimbursement and coverage of those services. It's really about making sure that services are more accessible, that the payment for services is more streamlined, and that the relationships that we've heard so much about in their importance today are built between our school partners and our health systems. We created a video, which I'm not going to show today. It's about 15 minutes. Gives a really good overview of what the CYBHI fee schedule is, how it will work within existing infrastructure of school-based behavioral health services, and how it differs from some of the programs that exist today. It also speaks to how schools can get involved and participate in the fee schedule, and we included the link in the slides so that you can watch it at your convenience, because I don't have actually 3 days to present. Some of the things that we wanted to call out in the way that the CYBHI is rooted in terms of the statutory requirements is that my department is responsible for establishing and maintaining the fee schedule. And health plans are obligated under state law to provide reimbursement to the local education agencies and their community-based partners for delivering services to a student. This is for students up to the age of 26, which means it's for all public K through 12 school systems, as well as California community colleges, the California State University systems, and the University of California systems. So we are working in great partnership with our county offices, education, local education agency, community college, university, and university partners to implement this initiative. The fee schedule on its face is a set of services with codes and eligible practitioners. So that doesn't really mean a lot. It's based on the Medi-Cal fee schedule, which is published and available on the DHCS website. But really, it's much more than just a set of codes and services. It's really about a program and a way about going about providing services to students to make sure that all students across all MTSS frameworks, meaning universal supports, supplemental supports, and intensified supports, that we can really think about making sure that kids get the support and care that they need, regardless of kind of where they fall in that continuum. As an example, the scope of services will include an array of services from psychoeducation, screening and assessment to make sure that we can identify the needs of our young people, therapeutic services, and care coordination, so that we can make sure that programs like the coordination of services teams are reimbursed for coordinating care for students and making sure that students' whole person care needs can be met and reimbursed through this infrastructure. The statute also authorizes the department to establish the provider network for services provided to students under this infrastructure. And so as part of that process, we recently, in August, released a set of operational readiness criteria that are those minimum requirements for local education agencies to be able to participate in the fee schedule. Really looking at things like whether they are Medi-Cal enrolled, which is a mandatory requirement, whether they have the service delivery infrastructure or need additional support to build up the infrastructure to be able to deliver services to students, whether they have the billing capacity to be able to submit claims for reimbursement, and whether they have the necessary infrastructure to document services in compliance with both HIPAA and FERPA, for example. All of the way that the statute is defined is that all services provided at a school site are eligible for reimbursement. That means specifically in statute that services provided by a school or district or campus and those services that are arranged for by the school or district or campus are eligible for reimbursement under the infrastructure. And so therefore community-based providers can also be a part of this statewide network at the election of the school or district or campus. This is just a diagram to show broadly how the fee schedule will work. So local education agencies or college and university campuses will enroll as providers. They will tell us who is on their designated provider list. They will deliver services to students in a school setting and submit a claim for reimbursement through a third-party administrator who will then request the payment from the plan and remit the payment back to the LEA or the County Office of Education. This program, the CYBHI fee schedule, really fits in to the infrastructure of school-based services provided broadly already in schools. Melissa already talked a little bit about some of the work that we're doing around the integration of the Community Schools Initiative and the CYBHI. We're also thinking very closely about the integration and what this means in terms of those districts that are participating in the local education agency billing option program. It really is also above and beyond what schools are already obligated to provide from a special education perspective. The statute specifically requires that services provided in pursuant to the IDEA are excluded from reimbursement under this infrastructure. However, there are still opportunities for federal reimbursement under the LEA BOT program for special education services. It also is not specialty mental health services that are provided in arrangements with county behavioral health agencies. Those arrangements can exist on top of the services provided as part of the CYBHI. We are taking a phased approach to implementation of the fee schedule. We really want to focus on making sure that we get this right. As we've been working for the last year and a half with our LEA and college and university partners across the state, one of the things that we've heard is we need to go slow to go fast, that we need to work in partnership and collaboration to make sure that we get this right rather than going out to the entire state all at once. We want to have the opportunity to learn from our mistakes, and we will make some, so that we can make sure that we are figuring out all of the intricacies of how to implement this very complex program across the state. So in January, we will launch the first cohort of local education agencies and health plan partnerships who will work with us and our third-party administrator to make sure that we work out all of the bugs and that we can refine the program for the second cohort, which will launch in January, and then for the entire state when we go live in January of 2025. We are considering readiness packages currently for 65 local education agencies, and we'll be making announcements about the first cohort by December 1st. So coming up quickly, and we have a lot of work still to do, but we'll be launching with that first cohort in January. I've already talked about some of these things, and so I just want to highlight one of the other work streams that is available to support local education agencies and county offices of education to stand up this really important initiative is a grant program that will make $550 million available, $150 million to colleges and universities, and $400 million to K through 12 institutions to provide the necessary infrastructure investments as well as capacity building and partnership support for our schools and districts to be able to partner with the appropriate community-based organizations, billing entities, or other providers in the community to be able to deliver services to students. We're partnering with the Sacramento County Office of Education and the Santa Clara County Office of Education to disseminate the dollars, and more information will be going out to each County Office of Education in the coming weeks. I'm going to skip some of this, but I do want to highlight this last bit before I turn it over to Sean, who's going to talk about the local perspective for implementing the fee schedule. We also have two other programs that are focused on social and emotional learning supports. The CalHOPE Student Support Program, which has been focused on establishing a statewide network and communities of practice around social and emotional learning and development, as well as curriculum support and infrastructure investments for local education agencies across the state to make sure that we're really positioned well to support the social and emotional learning needs of our young people. The other is a $65 million grant program to support mindfulness and wellness programming in schools, and is really focused on providing support and resources in all 58 counties to provide student-facing programming, invest in specialized communities of practice around well-being and mindfulness, as well as to establish ambassadors through a training program where educators can get continuing education credits for participating in training and resources around social and emotional learning and support. So both of these programs are being funded through all 58 counties, and there are resources available through all 58 county offices of education. All right, I'm going to turn it over to Sean. Appendix. Here we go. Is that you?
My slides. But those not them. I don't know whose those are.
Do you have them on your own computer?
Yeah, I do.
You want me to help you get that set up? Virtual?
I can pull it up
She
on
can pull up
here.
her slides, Elizabeth.
Yeah, I can pull it up.
I'm the least techie person in the world.
Pull them up.
Just
Just,
can you
pull them up here? Yeah.
Yeah, let me see if I can log in. How do I get to the internet here? There we go. All right. I'm like, I don't know what happened, but
Okay, we're breaking
we gonna break barriers anyway, okay? Look.
right here, right now. We're doing this.
All right, let's see here.
You got further along than I did. Takes a village.
Well, Google is great, isn't it?
Google.
Okay.
Anyone here from Google?
Anywhere you can take you anywhere.
And under pressure, Sean, good job.
I know. Now I'm stressed.
Now you're really learning Sean's power. So we're working on it.
No, you're okay. Here we go. You're okay. As long as, hopefully we can get some loading going. There
You
we
did
go.
it. Look
got
at you
it?
go.
Yep.
Do you want these here?
Yes.
Breaking barriers.
What's still
Keep
loading.
it. We keep it loose around here, just so you guys know. That's what it takes. You good?
It's just loading, I think. There we go.
It's not, is it showing, we need to,
You good? Oh.
That part. It's here.
So how do we feed it? Richard, do you know how to feed it to the screen?
It's an interface on the laptop.
All
If I
right.
put it in a PowerPoint, I can
Oh, no,
download
no.
it.
Well, actually,
I think they just need to change the feed.
hopefully,
5?
yeah. I'm just wondering if we shouldn't, like, what I could do is break for lunch and then do that and then come back. And then we could, should we do that? Or should
Somebody's got to be able to do that. Yeah, but somebody's,
We're getting technical assistance. We have it on the computer, but we do not have it on the screen.
does anybody know how to do that? Is there a tech person?
What if we
sitting on top?
download it and then open it in the PowerPoint?
Where is the screen that's being shown?
Just so everyone knows, just to give you a little sense for our agenda, just while we're doing this, we are going to finish this panel, and we're going to do a Q&A at the end of this for anyone who has questions. Autumn's going to stay here for 3 days, and she's going to answer all your questions. No, she's not. But you can certainly contact everyone here. In fact, I just want you to know that everyone who presents here is breaking barriers with us, and more than happy to have follow-up conversations with you about everything that they've presented, everything that they've said. We're our own technical assistance and support ecosystem here with all of our partners. And so to the extent you hear something and you want to reach out, all the slides and all the information will be pushed out, and you can call people. So I encourage you to do that.
Help is on the way.
We have help on the way. But the other thing I just wanted to say is after this presentation, we're going to take a half an hour lunch break. The agenda doesn't show that. So I just want you to know we're going to take a half-hour lunch break after this, and then we'll do our next presentation so everyone can stretch and get food and run around and break barriers together. All right, here we go. Hopefully we can pull this up.
And then it's the other set of slides. It's not this set. It's out of here. It's right there.
This one right here?
Yeah. There we go.
And the front.
All right.
Oh,
All
you're
right.
doing it.
Here we go. Here we go. Perfect.
Thank you.
Thank you.
You saved the day.
All right.
Appreciate it.
Not a problem.
All right, let's give it up for Sean.
All right.
A little stressful, Sean. Good job.
It was a little stressful, but we're going to see if we can pull it back together.
We can.
Sean Powell, pleasure to be here today. I have the privilege of currently serving as the Senior Chief of Student Services at the Alameda County Office of Education. And while I'm saying that, just let me say I'm from the Bay all day, and Jesus Christ had dreads. Okay? But I come by way of Santa Clara County Office of Ed, who I know is in the building. I see y'all as well. And in those two roles, I've had the opportunity to be on the forefront of two of the major initiatives that we're talking about in Santa Clara County, supporting as the lead agency in partnership with the CDE around expansion of billing programs in schools, and currently in the role that I'm in Santa Clara County, being a part of the statewide Transformational Assistance Center for Community Schools in partnership with Californians for Justice, NEA, and the UCLA Center for Community Schooling. I have a background as both a school social worker and licensed clinical social worker. And so I've done it in the school and in the community. Any social workers in the space? Okay. And what I'm going to try to do is really help us to reimagine. I think as we've been having this conversation, oftentimes what we do is imagine it in the constructs that currently exist. But what we're really asking folks to do is actually reimagine something new, rooted in the freedom dreams, health, and well-being of our young people. And so with my time today, I really want to take you on a journey where I'm going to talk about really three things. One is realizing the community schools vision in California, how integrated behavioral health and the CYBHI is a part of that, and then what does the fee schedule look like in action on a school site? Are y'all with me?
Yeah.
Now y'all really got to be with me because my nerves went up when my slides wasn't working. So, okay, look. All right. I'm a social worker, so when I say imagine, I really mean imagine. And so what I'd like you to do is pens down, pencils down, and what we believe in is this thing called visualization. And so I'd like to take you to a dream space. Welcome to the dream space. Breathe in your imagination. Rest and stay in this dream space, because another world is possible. You have everything you need. Stay in imagination. Welcome to the dream space. I'm going to ask you to stay in the dream space as I go through these slides, because we're imagining something that is completely new. Imagine a school site. A school site where there is a community schools coordinator facilitating a meeting with principals and community agencies and government agencies, parents and students, engaging in a dialogue around what it looks like to meet the health needs of students. Talking about how do we not just inundate services, but coordinate and align those services at the school site. In that same school site, there's a young person entering through the front gate of the school, and a partner from a community-based agency shouts out, "Are you ready to roar?" And for those of you who have been in a school site, you know that when we say roar, that is our positive behavior intervention that not only the student knows, but teachers know and community-based organizations know about what it looks like to show up in a school space. In this same school, there's immigration supports on campuses because a community needs assessment realized that the majority of students were first generation students whose parents were undocumented and needed to be able to have conversations and get support and guidance around their status. There's classrooms that have curriculum rooted in the community, connections to real life experiences of the students at that school. This is a community school. In California, we have been engaging in work to ensure that all schools are community schools. We believe that community schooling is just the way school should be done. And over the last year, although the community schools movement has been around for a long time. Any community schoolers in the space? Okay, so it's not new work, but what we're trying to do is scale and expand this work in California. And this began last year when the STAC really established a California framework rooted in 4 pillars, 4 key conditions for learning, 4 cornerstone commitments, and 4 proven practices, which you are looking at on the screen. From the framework, we're in this conversation around like, what is the California way of community schools? Really grappling with the questions of what, how, why, and sustainability. And being sure to think about how everyone in this room plays a role in the effective and efficient operation of community school strategies. I don't have time to go into all of this in detail today, but one of the things that you can see is that as we think about community school strategies and the what of that being integrated health in this case that we're talking about today, the multi-payer fee schedule, which Autumn talked about, and the entire CYBHI must be integrated into a comprehensive community schools strategy. Now, I ain't come to play, y'all, so let me just talk about the system, okay? This work is systems work. It requires reimagining our system from the ground up at the local level, the county level, and the state level. When we talk about reimagining this system, the decisions that we make must be rooted in the community assets and needs assessments that are happening on our school sites with our students and with our families. At the county level, we really need to be thinking about how we are aligning resources, staffing resources, funding resources, in order to remove barriers so that comprehensive school strategies can actually be implemented in a more sustainable way. We've been grassrooting community school strategies, and what if we imagined something different? What if we really all got behind thinking about it differently? And we need our state leaders to really support us in creating policies and providing funding that aligns with the needs of what has been found in the community assets and needs assessments conducted at the local level within our school sites. We also need to think very differently about how we provide those fundings to different agencies and the constructs in which oftentimes challenge the blending and braiding of funding, which poses significant barriers to actually integrating supports and services. And while I'm speaking to the technical pieces of policies, practices, and resources, I think folks in the space have been really clear that that cannot happen without relationships and connections and a shifting of power dynamics in terms of how are we showing up into spaces. And what that requires is a shifting of the mental models that many of us hold. And when I say many of us, I mean all of us. I tell people all the time that when I used to be in the community-based organization as a social worker, I used to blame the school because I didn't think they had it right. And then when I got to the school, I started blaming the community-based organizations because I didn't think they had it right. When I was a school site social worker, I blamed my principal because they didn't have it right. And then when I got to the district office, I blamed the county because they didn't have it right. And now I'm at the county and I thought I needed to blame the state because they didn't have it right. If we're being honest, These are the mental models that many of us hold in the space and that must be disrupted and deconstructed in order for us to really be one. The implications of the mental models are so significant that oftentimes, not only the mental models, but the current policies and structures oftentimes result in our initiatives looking like this. All of the pieces that we need scattered and siloed and disconnected, and young people and their families trying to figure out how to navigate it, how to move through it. And honestly, they just get sick and tired of being sick and tired of us. But what if we truly decided to engage in a collective impact strategy? A collective impact strategy centered around community schools. One in which across all of our entities, we truly share a common agenda with shared metrics that actually matter. And metrics that whether you're a school agency or a community provider or the behavioral health department or the managed care, that we all agree to so that we can actually have one plan. What if those conditions included having distinct and independent responsibilities, but ensuring that all of those were mutually reinforcing, where our communication was clear and consistent, and that there was some backbone coordinators in the space. I think somebody said that you need that coordination, so we need those backbone supports. And that as you have those conditions in place, that you also have some strategies, and those strategies must shift power. Those strategies must focus on our systems and not just practices and services, which we do a lot of and has unintended impacts for our families, which we've heard here today. And that we listen and act with the community, but also that we build the capacity of our leaders, the capacity of leaders to be centered in equity and accountability. I've had the pleasure of working in different county offices, and one of the counties that I've had the pleasure of working with is Santa Clara County. And so on the screen, what you're looking at is the way in which we organized ourselves for collective impact by establishing an interagency leadership team at our county level, backbone support, which includes leads from each of those agencies who actually facilitate the coordination of the initiatives, and then work groups. And in those work groups, we have backbone agency members, members of team agencies, including many of the ones in this place. And now we added our health plans, they at the table too, which has been really exciting, educators, students, and caregivers in those space. And what I've seen in that work is really powerful. One of the things that our interagency leadership team did was have conversations around behavioral health. And what was realized from this space was a county-wide initiative to mobilize and implement school-based wellness centers throughout the county. And to do that, we were able to blend and braid funding from SB HIP, our managed care plans, MHSA, district funding, philanthropy and private funding, the city funding of San Jose, and our county board of supervisors. They felt a little left out, so they decided to give $10 million too. I share this as an example with you because when you actually have one agenda with one method and common measurements, you really do have the ability to reimagine, and many of the barriers that we think exist actually don't. Putting it together, what we need is a framework or a strategy in schools that is community schools. Our method is MTSS, in which we think about what are the supports that we need to provide universally, the supplemental supports that need to be provided, and then when students need few supports, what might those look like? And that then we develop intervention strategies for each individualized student. Now, I wouldn't be me if I didn't give y'all an example. Can we talk about JJ?
Yes.
Can we talk about JJ?
Yes.
Okay, so JJ is my homeboy. When I was a school social worker, we hung out a lot. And he was always late to class and he was never engaged. He has a few friends, but he always really seemed isolated. And one day the teacher asked JJ, like, why you always late, bruh? I'm from the Bay, so that's what we say, bruh. Why you always late, bruh? And JJ got like stupid angry. Like he's just like off the chart angry. And he was like, I got hella shit going on. And then he just stormed out. And we were all looking like, why? What is going on here? And so the teacher refers JJ to the school social worker. When JJ meets with the school social worker, she conducts a CANS assessment, which is used by all agencies in the county. Not only does she conduct the CANS assessment, but she finds out that through that, JJ has experienced childhood trauma and is actually impacted by the child welfare system. On top of that, JJ's grandfather just died, and that was the closest man he ever had a relationship with, and he has a history of depression. And so the school social worker refers JJ to the COS team at the school site, which is a cross-systems team of professionals from different agencies, partner agencies, educators, social workers, and clinicians to engage in a conversation around how do we coordinate care to support JJ so he doesn't have to navigate all of our systems separately. The COS team develops a care plan for JJ and determined that he needs to get some health education around grief and loss because in his community, they don't talk about grief and loss. They just thug it out. And he needs to process his childhood trauma and he needs therapy. So he's referred to the community health worker who happens to be the wellness center liaison on his campus, and they engage in a conversation around strategies for dealing with grief and loss. And he sees a therapist. But when he walked in to see the therapist, he was pissed because he thought it was going to be a white woman. But the therapist, his name was Mo. And Mo was a black dude that looked just like JJ. And he thought he was gonna get cognitive behavioral therapy, but Mo was like, nah, we ain't doing that. In this space, we doing HHT, hip hop therapy, grounded in cognitive behavioral therapy. Any clinicians in the space? And so over the next several weeks, JJ engages with the community health worker and the therapist getting HHT. The COS team reconvenes, and lo and behold, when they do this CANS again, he has nothing that requires action. Y'all know we got the 1, 2, 0. Okay, all right. So that's JJ. From that example, I hope it becomes visible about what the service delivery side of this could look like. But I've got to connect this to the fee schedule for you. So in the example that I just gave, the CANS assessment, the health education provided by the Wellness Center liaison, the HHT therapy grounded in CBT, and the COS team meetings are all billable services. In the example on the screen is what that could look like in the current codes. What I will note though is the rates are not yet finalized, so those are just meant to be illustrative. Welcome back to reality. I'm welcoming you back to reality, but the reality is that the CYBHI is real, MTSS is real, and so is the fee schedule. And even though I've shared all of this with you, some of you are still trying to hold the question of how do we change? How do we become the people that can meet this moment? And you're trying to hold it in this way that doesn't produce more urgency, fear, or anxiety, but produces courage and a connection and a willingness to get it. Is that you in the room? Sure. So what I want to leave you with is I want to encourage you to hold it and believe. You can't become what you can't see, what you envision. Hold it and heal the mental models, the biases about the intentions of the other folks in this room, the other institutions in this room. Hold it and engage from a place of curiosity and possibility. Hold it and act because our young people are depending on us to hold it and innovate together because none of us can do it alone. Thank you guys.